A single modern hospital network manages between 10 and 25,000 connected medical devices. These machines provide direct, breath-by-breath patient care, like this mechanical ventilator. Because these devices are connected, they carry a hidden vulnerability. A single firmware attack can bypass perimeter network defenses to manipulate drug dosing algorithms, disable critical safety alarms, or extract protected health information. Manually auditing the security posture of 25,000 independent machines on a continuous basis is physically impossible for biomedical teams. Left unmanaged, this sprawling fleet represents a catastrophic liability to patient safety and hospital operations. When a critical vulnerability is discovered in one of these machines, the traditional response is a physical field recall, sending technicians to manually update thousands of units. This process routinely costs manufacturers upwards of $10 million per incident. This financial risk, combined with rising patient safety threats, has prompted strict regulatory action. The FDA now enforces pre-market cybersecurity mandates, requiring manufacturers to prove their devices are secure by design before they can be sold. With physical recalls threatening profits and regulators demanding proof of integrity, cryptographically rooted security has become a mandatory requirement for hospital procurement. TrustEdge addresses this structural flaw using a hybrid architecture. It anchors security in physical hardware embedded within the device and orchestrates that trust through a continuous cloud management platform. During assembly, the EdgeLock hardware root of trust module is soldered directly to the device's main board. The unique device identifier, manufacturer lot number, and initial firmware hash permanently bind to the chip, generating an unclonable cryptographic identity and a sealed security log. This hardware-rooted manufacturing process gives device makers the exact auditable chain of custody required for their FDA 510(k) or PMA cybersecurity submissions. When that device arrives at the hospital, its factory-injected identity drives the entire onboarding process. As soon as it powers on at the bedside, the machine executes an automatic, zero-touch connection to the hospital's cloud network. This mutual authentication handshake bypasses manual IP configuration and certificate loading. By automating these steps, it removes the human errors that cause most healthcare network breaches. During day-to-day operation, clinical staff frequently attach physical probes to track patient vitals. Introducing unverified, counterfeit consumable accessories can lead to inaccurate readings and dangerous misdiagnoses. This diagram illustrates the monitor challenging an embedded Edge ID chip inside the accessory. The device requires cryptographic proof of calibration and origin, verifying the signed certificate against a known good database before it will accept and display the clinical data. By automating network trust and physically blocking counterfeit parts, TrustEdge allows clinical engineers and nurses to focus entirely on care delivery, free from manual cybersecurity protocols. Behind the scenes, the hospital's biomedical security team gains complete visibility. TrustEdge automatically gathers continuous attestation data from every single unit across a 25,000 device fleet. This dashboard monitors fleet-wide posture, constantly comparing live firmware hashes against baselines to instantly quarantine non-compliant devices. For critical vulnerabilities, it orchestrates a phased over-the-air firmware update, flowing the patch from the cloud to thousands of devices across departments simultaneously. At the endpoint, the local hardware acts as a failsafe. The EdgeLock HROT mathematically verifies the manufacturer's digital signature before allowing the new code to install, and then reports a cryptographic receipt back to the cloud. Eliminating the $10 million physical recall allows manufacturers to maintain fleet integrity without the logistical burden of manual field service. From the moment of manufacturing to its final secure decommissioning, TrustEdge turns a vulnerable endpoint into a verifiable, secure asset. The commercial model combines an initial hardware transaction with manufacturers and a recurring cloud orchestration subscription for hospital networks. Because high-value capital equipment like the CT scanner operates for 10 to 15 years, the orchestration subscription remains active throughout the machine's entire deployment. TrustEdge provides the foundational, legally mandated security architecture required for the future of connected medical care.